everybody. It's Global CE Day, and glad you're with us. And we have Mohammed Ameel from Ministry of Health, India. Mohammed, tell us about your job there.
Hi, Tom. First of all, very, very happy Clinical Engineering Day to everyone throughout the globe. So I am currently based out of the Ministry of Health and Family Welfare, although just for COVID firefighting, although uh, I should be in National Health System Resource Center, which is again a part of Ministry of Health and Family Welfare. What we currently do is help the ministry as a think tank. So we develop technical specifications of medical devices. We help them draw policy for medical equipment maintenance, help them support on safety regulation compliances. Our division is also responsible for health technology assessment. And most importantly, we house two of the main national programs on free diagnostics initiative and national dialysis program, which has a direct patient outcome.
Sounds like a busy man. I know you're also a family man. So Mohammed, what's it been like during COVID? I know you've got some specific roles during this time.
Yeah, so one of the key roles that we are these days playing is on the oxygen space, and we are managing the oxygen control room for the country. And so our main responsibility has been to ensure that oxygen is there available and everyone has access to it. Our demands have gone multiple times compared to the routine days. So we've given industrial oxygen manufacturers permission to manufacture medical grade oxygen. Now we are on war footing getting installation of PSA oxygen generation plants, and we are also for the first time in history looking forward to import oxygen, although that's just for as a safety precaution. We currently have surplus of oxygen. This is specifically on the oxygen space, but we've been supporting ministry in other technology intensive programs as well. But oxygen takes the most crucial part of our thinking. Back to you.
So have you been able to get near patients? Do you know, the impact of this great work you guys are doing?
So certainly the impact is amazing. So if you see, even though the requirements of oxygen have gone multiple times what we used to consume earlier, we have been able to work with the limited resources without having any major issues around. And believe me, it's not only having surplus oxygen at the national level. We have to ensure that surplus oxygen is there in every state, in every district, and in every health facility. And that's a task that we've been doing. And no calamities means the impact has been positive so far, right?
Yes, sir. So I understand what, perhaps 700 public hospitals? I know there's a big private system as well, but you've got a huge responsibility.
Yes, and the numbers that you're talking about is only district hospitals. We have tertiary care medical colleges as well, although there's a different directorate which looks after, but in the oxygen space, it has come to all of us, and we have a lot of smaller health facilities below the district as well, the community health centers, the primary health centers, the sub centers, and all. Yes.
Yeah, it's a big place. We know that. So switching gears here, how are you feeling about the status of clinical engineering in India? I know there's been a lot of development.
Certainly, there has been a lot of development. A lot of state governments have now biomedical engineers in place. Having said that, we have a long way to go. Clinical engineers have to have an important role to play, not only in the policy making space, but also in each and every health facilities. So now, although we have a nationwide biomedical equipment maintenance program, where third-party agencies are involved for equipment maintenance and management, Having said that, not all the state governments in the country have employed biomedical engineers, but the better performing states certainly have at least one in the per district. There are states in the country which have more biomedical engineers employed than than the number of districts that they have. So I think the not so good performing states are certainly looking up to them, because what we feel is that technology is the answer for the scarcity of human resources, specialized human resources that we have in the country. And clinical engineers are the doctors of technology. So someday or the other, we'll have to have them in the system.
What are what are the prospects for clinical engineers across the country, biomedical engineers coming together in a national society or something like that?
Yes, so we have a Biomedical Engineering Society of India, which needs to buck up again, not doing that great as on today, or maybe someone else will have to take a leadership role. But a lot of state governments, rather the states, have their biomedical engineering societies, which are doing wonderful work. Last week I heard Kerala's biomedical engineering society called Betak wrote to all the member of parliaments and the members of legislative assembly in their states, suggesting what is the role of biomedical engineers, clinical engineers, and what prospects they look forward to, and what change they could bring if they are made an crucial part of the system. And that was a very welcome work that these guys did.
Any thoughts on how the global federation we're a part of, IFMB-CED, could help India? I mean, I know you were a great moderator in our first WHO CED critical town hall on COVID topics in May. So I know you and others there in India are making huge contributions to the global setting. How can CED help India, you think?
So, Tom, you and your colleagues are certainly an inspiration for us, and we certainly look up to you all, and would look forward to your support and guidance in doing the advocacy for us, and suggesting the government at the highest level what major or crucial role that we play in the overall health system strengthening, and with some of the global best practices that we could document with your help. Certainly we are showing a lot of positive outcome with our work here, but unfortunately not many of us are a part of the system. So we look forward to some advocacy and documentation from your end to help us take it to at a bigger level.
And in closing, Mohammed, a great time here together. What's your vision for the future of clinical engineering in India?
So what I feel is that clinical engineers, and rather what I dream of, is that clinical engineer should be an important part of the hierarchy of the health systems in the country, and should have a very, very important role in the planning, policy making, and implementation of that policy, so that the gap between the technology and the human resources that we have doesn't stay for long, and the health outcomes are improved with the help of clinical engineers and other human resources that play a crucial role in the overall health systems.
That's a great vision, and we thank you for your time today, Mohammed.
Completely my pleasure, Tom, and Kelly. Thank you so much for having me here.
And bye for now.